Are you aware of the hidden threat of monkeypox? While it may not have the same notoriety as some other viruses, monkeypox has been making headlines recently, and understanding its characteristics is key to staying safe. In this video, we'll dive deep into the monkeypox virus, its origins, symptoms, and why it's spreading outside its typical regions. Make sure to subscribe for more critical health insights, and share this video with others to help raise awareness. The monkeypox virus belongs to the poxviridae family and is similar to the smallpox virus but with generally milder symptoms. First identified in 1958 during outbreaks in monkeys, it wasn't until 1970 that the first human case was recorded. This virus can infect not only monkeys but also other rodents like squirrels and groundhogs, which act as natural reservoirs for the virus. It's important to know that these animals play a significant role in spreading monkeypox, particularly in areas where these species are abundant. Although the symptoms are similar to smallpox, including fever, muscle aches, a skin rash, and swollen lymph nodes, monkeypox is usually less severe. However, the recent outbreaks have shown that, while not as deadly as smallpox, it can still lead to complications like secondary infections. In some cases, particularly among vulnerable populations, including children and individuals with weakened immune systems, the virus can still result in serious illness or even death. Understanding these characteristics is crucial for recognizing the early signs and seeking proper treatment. Stay tuned as we explore how monkeypox spreads, how to protect yourself, and the preventive steps you can take to stay safe. Don't forget to subscribe for more crucial health information, and share this video to help spread the word and keep others informed. Monkeypox transmission primarily occurs through direct contact with infected animals, such as rodents or monkeys. This can happen through direct contact with their blood, bodily fluids, or open lesions on their skin. Another way the virus spreads is through the consumption of undercooked animal meat. These routes highlight the risk of monkeypox in areas where people are in close contact with wildlife, particularly in regions where the virus is endemic, such as Central and West Africa. In addition to animal-to-human transmission, monkeypox can spread between humans, though it is less contagious than smallpox. The virus can be transmitted through respiratory droplets when an infected person coughs or sneezes, or through direct contact with their bodily fluids or contaminated surfaces. While human-to-human transmission is possible, it is still not as easily spread as more common viruses, such as the flu. However, in closed settings or during prolonged contact, the risk of transmission is higher. An alarming development from recent outbreaks is that monkeypox has spread beyond its typical endemic regions. Initially confined to Central and West Africa, the virus has now been reported in countries outside of these areas, raising concerns about global health security. The increase in cases outside its usual habitat suggests the virus could potentially spread more widely, making it essential for the global community to monitor and control outbreaks to prevent further transmission. This expansion underscores the need for heightened awareness and preparedness on a global scale. Monkeypox symptoms typically begin with general signs similar to those of many viral infections. These early symptoms include fever, fatigue, muscle aches, and a headache. These initial signs can easily be confused with other common illnesses, making early detection a bit challenging. However, the key distinguishing factor of monkeypox is the appearance of a rash, which typically develops a few days after the onset of these flu-like symptoms. The rash often starts on the face and then spreads to other parts of the body, including the hands, feet, and sometimes the genitals. The lesions can range from small, red papules to larger, also like sores with crusts forming as they heal. These lesions are characteristic of the virus, and the progression of the rash is a key feature that can help distinguish monkeypox from other similar diseases. While most cases of monkeypox resolve in 2 to 4 weeks, complications such as secondary bacterial infections or more severe illness can develop, requiring medical attention. Because monkeypox shares symptoms with other viral infections, a clinical diagnosis can be challenging without further examination. The presence of the characteristic rash, however, can often lead healthcare providers to suspect the infection. Still, to confirm the diagnosis, especially during an outbreak, laboratory tests are essential. Polymerase chain reaction, PCR, testing is the most reliable method for detecting the virus, as it identifies the genetic material of the monkeypox virus in tissue or fluid samples from the lesions. In addition to PCR, serology, and other laboratory tests can also be used to support the diagnosis. Early and accurate diagnosis is crucial for managing the infection and preventing further transmission. Monitoring progression of symptoms and getting tested promptly can help ensure that individuals receive the proper care before complications arise. With outbreaks occurring outside the typical endemic regions, awareness and timely medical intervention are essential in controlling the spread of monkeypox. Monkeypox prevention and treatment largely focus on managing symptoms, as there is currently no specific antiviral treatment approved for the virus. Most treatments aim to alleviate discomfort, such as using pain relievers for muscle aches and fever. In severe cases, antiviral medications like tecovirimat may be used to help reduce the severity of the illness. However, this treatment is typically reserved for more serious cases and is not a cure for the virus. Additionally, isolating patients who are infected is essential to prevent the virus from spreading to others, especially in areas where human-to-human transmission is more likely. When it comes to prevention, the most effective measures involve controlling the spread of the virus through rodent and monkey control. Since the virus can be transmitted from animals to humans, limiting human contact with infected animals is crucial, particularly in regions where monkeypox is endemic. This includes avoiding contact with rodents, monkeys, and other animals that may harbor the virus. Practicing proper hygiene and avoiding consumption of undercooked animal meat also plays a key role in reducing the risk of infection. In areas where human outbreaks are occurring, further preventive measures become necessary. The use of masks and social distancing can help prevent the transmission of monkeypox from person to person. Isolating infected individuals is particularly important, as the virus can be spread through respiratory droplets or contact with bodily fluids. These steps are vital to contain the virus, especially when outbreaks occur in densely populated areas or in healthcare settings where the risk of spread is heightened. Additionally, there is some cross-protection available from the smallpox vaccine, as both smallpox and monkeypox belong to the same virus family, poxviridae. The smallpox vaccine has been shown to provide partial protection against monkeypox, but it is not widely used today. Vaccination is more commonly administered in high-risk areas or to individuals who may be at higher risk of exposure, such as healthcare workers or those living in endemic regions. While vaccination can be an effective preventive tool, its limited use in many parts of the world makes ongoing public health efforts critical to managing the spread of the virus. In conclusion, monkeypox is a virus that, although recognized for decades, has gained significant attention recently due to an increase in cases outside of its usual endemic regions. While the virus shares similarities with smallpox, including symptoms like fever, muscle aches, and a rash, it tends to be less severe and less fatal. However, it is important to remember that despite being a milder disease compared to smallpox, it still requires close monitoring and vigilance, especially when outbreaks occur outside of Central and West Africa, where the virus is typically found. The recent rise in monkeypox cases beyond its endemic regions is a reminder of how easily diseases can spread in today's globalized world. This emphasizes the importance of preventive measures to reduce the spread. While the virus may not be as deadly as smallpox, the potential for secondary infections and complications still poses a risk, particularly for vulnerable populations such as young children and people with weakened immune systems. Therefore, it is crucial to continue focusing on prevention and preparedness to manage potential outbreaks before they escalate. Prevention of monkeypox focuses on several key actions, including rodent and monkey control to limit human exposure to infected animals. Practicing good hygiene, especially when handling animals, and avoiding undercooked animal meat are essential to minimize risk. In regions where monkeypox is more prevalent, mask use and social distancing help reduce the likelihood of human-to-human transmission, making these precautions vital in managing outbreaks. Keeping infected individuals isolated is also critical to prevent further spread. Additionally, the smallpox vaccine has been shown to offer cross-protection against monkeypox, as both viruses belong to the same family. Although the smallpox vaccine is not widely administered today, its use in high-risk areas or among healthcare workers can provide additional protection. In areas where outbreaks are most likely, vaccinating at-risk populations may be a key component in reducing transmission and ensuring that the virus does not spread unchecked. As we face the challenge of monkeypox outside of its usual habitat, awareness and global surveillance are more important than ever. It is essential for people worldwide to stay informed, understand how the virus spreads, and take the necessary precautions to protect themselves. If you found this information useful, make sure to subscribe to our channel for more updates on global health issues. And don't forget to share this video to keep others informed. Together, we can help prevent the spread of monkeypox and other emerging diseases.